Hi everybody and welcome to UroChannel. In the comment sections of my videos, some of you requested that I do something about the treatment of premature ejaculation. Okay, this is a video about what I do in these cases. But before we start, I really advise you to watch one of my former videos that for some reason never got much attention. It is about the definition of premature ejaculation. There is not only one, but 4 kinds. Knowing what type of PE one is dealing with makes a huge difference when it comes to treatment. I am linking the video at the end. Just click on it and it will play automatically. In lifelong PE, treatment comes down to on-demand or permanent medication. Unlike with other forms of PE, there is no cure. It is possible to increase the IELT, the intravaginal ejaculation latency time, but only pharmacologically. As soon as the treatment is abandoned, everything will return to where it was before. This is why it is very important to establish the proper diagnosis right from the beginning. Drugs that are approved for PE are Dapoxetine and Lidocaine Prilocaine spray. Dapoxetine belongs to a group of drugs by the name of SSRI, which is selective serotonin reuptake inhibitor. Serotonin is a hormone in the brain that has a significance for ejaculation. Dapoxetine increases its concentration and this results in a prolonged latency time. The big advantage of Dapoxetine is its short duration of efficacy. It is absorbed quickly and stays in the body only for a short time, which makes it ideal as an on-demand drug. Lidocaine and Prilocaine are anesthetics, which decrease the sensitivity of the penis. There are several products on the market. The sprays get absorbed within a short time, but with local anesthetics, it might be wise to use condoms. My professional experience with local anesthetics is not very good. It is worth a try, but as a rule, only SSRIs are able to make a real difference. Dapoxetine is not working for everybody though. Plus, it is expensive. In Germany, it is roughly 11 euros per tablet. Other SSRIs are much cheaper and very effective as well, but so-called off-label, meaning that they are not approved for the use in premature ejaculation. Low-dose paroxetine works well in the majority of patients. This is the drug I kind of settled on because I think it is important to have a feel for the medication one is prescribing. There are other SSRIs and other classes of drugs that work as well, but for me personally, if choosing off-label medication, I don't want to prescribe all over the place, especially drugs that I have no experience with. But anyway, this is no experimental approach, as SSRIs are part of the guidelines of the European Association of Urology, for example. Paroxetine has to be taken daily and takes effect after approximately 3 weeks. 1 tablet costs 20 cents, which means that the price for 1 tablet of Dapoxetine equals almost 2 months of treatment with paroxetine. I don't want to go into detail about side effects in this video. If you are a candidate for such a treatment, please talk to your doctor about it, as this video is not a substitute for a medical consultation. Every patient has to be treated individually and every doctor has to take his own responsibilities. I know a number of doctors who are not willing to prescribe anything off-label. Okay, back to the topic. What about the start, stop and squeeze techniques? They are not my favorites and I don't recommend them. These are historic and certainly made sense at the time they were invented back in the 50s and 60s. That was well before the SSRI era. On the internet and in the media, these techniques are still very much alive. It seems everybody is copying from each other, and I very much doubt that anyone who is promoting them has tried them for themselves. The majority of my patients is reluctant to on-demand medication because sex is no longer spontaneous. And how much spontaneity is there in stopping every few seconds and then also squeezing the penis once in a while, which might also be painful? Okay, rhetorical question. Some of my patients have tried it, but they abandoned it altogether because it makes sex a nuisance. Complementary sexual counseling of the couple is useful in my opinion, because pressure and performance anxiety often worsen the problem. It is important that both partners work together here and use their relationship as the foundation. So this is for lifelong PE. Acquired PE is another story, and I'll do a video about it as well. In the meantime, I really recommend that you watch this video. Otherwise, you might not understand what I'm referring to. Thanks for watching. Bye bye.